rabbits in Ohio.
For those people who already have whatever, whether it's 1, 2, or 8 or 10 mercury fillings in their mouth, whatever they have that's still there, and no matter how old it is there something that you recommend to chelate out the mercury in the body until the rest of the amalgams can come out?
I do it. I have an illustrator who's done some wonderful drawings for me, and he has a drawing of a fellow standing in the shower, and the water's coming down, and he's got a towel drying off. Well, does this hurt anything? No. But is it doing any good? No. So, yeah, you can, chelation is a whole different barrel of snakes. But if you take out 10 micrograms a day and you're putting in 20, what benefit are you doing? If I look at the blood chemistries, if you've got a problem, I don't really see that taking out what's in the bloodstream for that few minutes is going to change anything in the chemistry. You've still got the problem. You've still got the attack to the heart, to the liver, to the kidney, to the brain.
When you look at the blood chemistry, let's say my blood chemistry, which is in front of you for 4 months ago.
Yeah.
What do you look to see mercury impacts?
The whole chemistry. Because in some people it affects the calcium, in some the phosphorus, in some the cholesterol of all things, in some protein metabolism, in some it's liver function, some it's kidney, some it's red cells, some it's white cells. I don't know what your genetic weak link is, but your blood does. All I have to do is learn to recognize in the blood chemistry where the variations are that shouldn't be there.
Are there many people that are able to recognize those patterns in blood chemistry the way you can?
What do you mean by many?
Well, I mean, several handfuls in the U.S.
Probably not.
That's scary.
If you do that, the Dental Association will take your license away. There are certain things that are extremely important. The electrical charge on the filling. If you take out one with a positive, they're like little tiny batteries. All right, if you take out one that has a positive electrical charge on it, first, if that's the first filling that comes out, this is going to stimulate some of the hormone-producing glands that are in charge of degeneration, which you don't need at that time if you're sick. And if you take out one with a negative electrical current, you stimulate the opposite 4 endocrine glands, hormone-producing glands, and you go into regeneration. Well, in the state of Colorado, if you use that instrument, they'll take your license away. I'll let you figure out why that is. It should be pretty simple. I haven't figured it out yet, because what that does is encourage disease and prevent healing. And Colorado is the worst state in the United States as far as taking away a license of a dentist if he ever shook hands with me or said anything bad about mercury. If you say something bad about mercury, all they have to do is send you a letter saying you lost your license, you cannot be relicensed in any of the 50 states.
That's a tragedy.
So you ask why dentists don't get into this. It's because if you're trained as a dentist, you're not trained to do anything else.
Can dentists quietly do these other protocols as part of their practice?
Yes, we do have a team around the nation that do this. They are really gutsy. They will stand. In fact, there are a couple of towns in California that have banned the use of mercury, or it has been a proclamation signed by the mayor. I just got an email on this yesterday. And they're trying in another city, and they were going to have the meeting for the signing of the proclamation, and something like 100 dentists came up in arms saying, no, we've got to keep poisoning people. No, that isn't what they said. We've got to keep placing mercury. You cannot tell us not to place mercury. And so they had to postpone the meeting, and now the mayor's having to sit there listening to 100 dentists say that in the mouth its toxic properties are rendered harmless. California is a leader. The state of Maine has done some things. The state of Washington and Oregon, I think, have done some things. And then there's something called the United Nations. Maybe you've heard of that? United Nations has a committee on addressing the problem of mercury because it's poison. And they're trying to ban its use around people worldwide. And they've had 3 meetings, one every 6 months. I think they've got one coming up in Nairobi in about 2 months. And 18 months ago, dental amalgam was the last one on the list that they were considering of the areas where mercury should be abolished. And for the one coming up in Nairobi, thanks to the work of Charlie Brown, an attorney in Washington, D.C., and a whole bunch of people out in California, it is now number 1 on the list. So there are 120 countries who are considering the banning of mercury, like Sweden was the first one to do it, and there are several other countries that have followed suit, everybody except the United States.
Wow. It's also true that in the United States there have been many, many cancer cures that are illegal, and doctors go to jail for using these protocols. And a lot of these protocols are alive and well in Europe and other parts of the world. It's a similar scenario.
Right.
Do you think that dentistry is very expensive? And I find it interesting that most insurance companies don't want to pay for it and don't want to deal with it. Mm-hmm. Most people are not in a position to deal with dental problems. Do you think that dentistry, using your protocols and your whole system's approach to dentistry, will become more affordable and less expensive?
Well, I was approached not very long ago to go to an island not too far from here and set up a system. We used to have a system here with 76 employees that we treated patients from all over the world. And we were having tremendous success rate, which, of course, is why they shut it down. But they're trying to do this in some other countries now. Some of the smaller countries, especially with economic depression, would welcome having people come in, and the dentistry there could very easily be done for 50% of what it's done here. But it's interesting to me that I know when I first went into practice, a one-surface filling, amalgam filling, I got $5 for doing that. And my neighbor sold Cadillacs, and Cadillacs were $6,000 at that time. And now Cadillacs are not $6,000, but $60,000. So add a zero to it, which means a $5 filling should be $50. But they're not. They're $250.
It's ridiculous. It's ridiculous.
Dental fees have gone up tremendously, and the expense of running the dental practice has gone up tremendously.
Do you think it's due to regulation or over-regulation? What do you think?
I don't know.
Okay.
Politics I've never been able to understand.
In biological dentistry and whole systems dentistry, I want you to share what is typically and traditionally done when crowns are put on a tooth.
Well, traditionally, the thing that bothers me is that a few years ago, 85% of the crowns that were placed, which is a metal covering over the whole tooth, were made of nickel, which is the number 1 cancer-producing metal on the planet. Mercury kills the cell, and nickel makes it cancerous. So which would you rather have? Now, with the cost of gold going up to $1 bazillion an ounce, I'm having dentists call saying, what's the only thing I can do here? And I said, well, the only thing I can recommend is the gold that is about 90% gold, 10% platinum, something in that vicinity. And I said, well, the price of gold is so high that we can't afford to charge a patient just for the materials anymore. So everybody's going to nickel or some of the other things that may or may not be healthy. But if you want to see an increase in cancer, combination of root canals and
crowns
is certainly the best way to get there, and that's the biggest financial institution in the United States is cancer. So, yeah, that is creating a problem. I do not see the way out at this time. Partial dentures used to be made out of nickel, and I don't know, 10, 15 years ago they started using other materials.
What is a partial?
Partial it's short for partial denture. A denture, by definition, includes all of the teeth. A partial denture means you've lost anywhere from 1 to 3/4 of the teeth, and a denture that covers partially all of the teeth is placed. So a partial denture, most of them probably